But we begin tonight in the middle of the health care fight. In the Senate Finance Committee, where there's no more Gang of Six, there's no more faith-based mythical kumbaya bipartisan compromise. Finally, the whole committee, 13 Democrats and 10 Republicans, were able to vote today on whether Americans, at least some of us, will get the option of buying the same kind of health care that people with Medicare currently enjoy. On the table today were two different amendments to put a public option in the bill. One from Senator Chuck Schumer of New York, one from Senator Jay Rockefeller of West Virginia.
70% of the American people want this. I know supporters of the status quo are saying that it's simply, again, a government takeover, but let me set the record straight once and forever. This will be optional. Nobody has to do this. But I feel so strongly about it because it makes so much sense. The people that I represent need this.
That was Senator Rockefeller, of course, from the Republican side.
So if you support single-payer health care, if you support longer waits, crowded emergency rooms, lower quality of care, in other words, the rationing or the denial of care or the delay of care that you get in single-payer systems, do you want that for America?
Rationing? Denial of care? Is that what's actually being proposed? Surely Democrats aren't going to let that sort of litany of negative descriptions slide, are they?
The main knock you've made on Senator Rockefeller's amendment, I presume on mine, is it's government run.
Yeah. But
Medicare is government run, and most people like it very much.
Okay, but if it will come to a single payer, and that denies the American people choice. What's good now about Medicare Advantage is people in my state have 44 choices to go to, and what you would be leading us to would be a system where there isn't choice. Now, I want to give senior citizens choice.
Would the senator yield? Yeah. Would Senator Grassley yield? Now, you just made a statement that it will lead to a single payer. Yeah. How in the world do you make that leap?
Well, you know, there are health economists around here, and I can only quote two. One is Heritage says that 83 million people are going to be forced out of their plan, employer plans, into the public option. And Lewin Group says 120 million.
Who's that? It's the Heritage Foundation, right-wing think tank, and the Lewin Group. Those are the research firms he can remember that have been supplying congressional Republicans with their information about why health reform is such a bad idea. Conveniently, the Lewin Group is the health insurance industry. The Lewin Group is run by a wholly owned subsidiary of United Healthcare Group, which is the second largest health insurance company in the country. Beyond the statements of the senator from United Health, then, any other major arguments against the public option today?
If you went home in August and you heard from your constituents the way that most of us heard from our constituents, people are really afraid of the, quote, public option. I put it in quotes because many of us on this side believe that it will lead to a government-run system, that it will lead to a single-payer.
The people are really afraid, says Senator Ensign. In fact, 65% of Americans are so afraid of the public option that they said in the last New York Times CBS poll that they would please like a public option. 65%. You know, the least surprising news of the day today was that not a single Republican would vote in accordance with that 65% of the American people. Not a single Republican would vote for the public option. But that doesn't really legislatively matter, right? After all, the committee has a Democratic majority, and surely Democrats will vote for a public option, won't they?
My job is to put together a bill that gets 60 votes. Now, I can count. And no one has been able to show me how we can count up to 60 votes with a public option in the bill.
Democratic Chairman Max Baucus says it's not that he doesn't want a public option. He does. He just won't vote for it unless everyone does. Leadership. In all, on the first public option choice, Senator Rockefeller's amendment, there were 5 Democrats who voted no.
Mr. Conrad?
No.
Mr. Conrad? No. Mrs. Lincoln?
No.
Mrs. Lincoln? No. Mr. Nelson? No. Mr. Nelson? No. Mr. Carper? Mr. Carper? No. Mr. Chairman?
No.
Mr. Chairman? No.
Thus, the Rockefeller Amendment in a majority Democratic committee dies, with only 8 senators in favor and 15 voting against. Senator Schumer, your turn.
There's no question that the public option would improve this good bill.
So what say you, Democrats, to the second public option choice of the day, the Chuck Schumer Amendment?
I will vote for the Schumer Amendment.
Senator Nelson of Florida switches sides. He's on board now. Anybody else?
Mr. Carper.
Aye by proxy.
Mr. Carper, aye by proxy.
Senator Carper of Delaware switches sides too. Will the remaining 3 anti-Rockefeller Amendment Democrats now follow suit?
Mr. Conrad.
No.
Mr. Conrad, no. Mrs. Lincoln.
No by proxy.
Mrs. Lincoln, no by proxy. Mr. Chairman.
No.
Chairman votes no.
No, no, and no. And let me guess, Mr. Chairman, Senator Baucus, you voted against a Democratic amendment for an option you say you support. Again, why? Because?
I don't see that a bill out of this committee with public option gets 60 votes, so I'm constrained to vote against the amendment.
That's at 3:50 p.m. Eastern Time in a 10-4, 13 against vote. The Charles Schumer Public Option Amendment died alongside its Rockefeller counterpart. What does this mean? Well, joining us now from the Russell Rotunda on Capitol Hill is Senator Chuck Schumer. Senator, thank you for taking the time on this busy day.
Good evening.
You and I agreed on Thursday that if the public option could make it in the Senate Finance Committee, it looked pretty good that it could make it anywhere, maybe all the way into the final bill. What does it mean that it didn't survive that committee today?
Well, look, it would have been better if it had passed, and certainly it didn't. But we picked up votes we didn't expect, particularly on my amendment, Jay and I working as a team. And, you know, the Senate Finance Committee is the toughest terrain here. It's more conservative than the Senate as a whole, populated by a large number of rural senators. And the Senate as a whole is less conservative, is more conservative than the House. So this is an uphill fight. We knew it. But, you know, a month ago the public option was dead. Now we're alive and fighting. Even 2 of the 3 senators who spoke out against it said they were interested in it. And we're going to keep working at it till we get this done. It's too important to good health care not to have the public option. And while I wouldn't say to you we're definitely we're certain of winning on the Senate floor, we're going to work hard at it, and I think we have a pretty good chance.
There were 5 Democratic senators who voted no on Senator Rockefeller's amendment. Only 3 of those senators voted no on your amendment. Did you imagine that you could pick up potentially more Senate Democrats who voted no, some of those 3, by further changes, or you think they're qualitatively opposed?
No, I think they're open to change. I mean, Senator Baucus himself, as you showed on your show, said he was for it but wanted to see 60 votes. He obviously cares very much and wants to pass a health care bill. And I think, I said this in the committee meeting, that by working hard we'll be able to show him 60 votes. It may not be exactly as I proposed or as Jay proposed, but it'll be a good, strong public option. I have spoken to just about every one of my moderate Democratic colleagues. Not a single one has closed the door on the public option on the Senate floor. So to say that the bill is dead and this is over is wrong. It's underestimating the strong support we have out in the country. It's also underestimating the fight of those of us who care a lot about it. Again, is this going to be easy? No. But at the end of the day, as you go through the process, I think we have a darn good chance of getting a good public option in the bill.
Let me ask you about one thorny issue that I know has a lot of political oomph to it, and that is the 60-vote threshold. When you say that the public option doesn't necessarily have 60 votes now, it might ultimately have 60 votes. When you assume that 60-vote threshold rather than 50 votes, are you saying that some Democrats would literally filibuster a Democratic reform bill just because the public option was in it? Democrats will vote to filibuster?
Well, they can propose a filibuster on the specific amendment, not on the bill. But that's one of the things we're looking at here, saying to some members, look, a vast majority of the caucus supports public option. Vote yes on cloture to let us have the vote, and then vote your principles, conscience, whatever you will, when we get to the 51. So yes, that is a real chance to do this. Obviously, we're first trying for 60. If we can't get to 60, some of us will argue that for the public option and some other things, we can go to the 51 vote margin. Not so much on reconciliation, but getting Democrats to vote for cloture, even if they don't support the bill, giving your fellow Democrats a chance to have their voice.
Do you have support from other members of the Democratic leadership, and specifically from Senator Reid, for an approach like that?
Well, Senator Reid has not unveiled his approach. We've been talking about it. He's waiting till the Finance Committee finishes the bill. But I know he is for a public option. Each member of the leadership of the four in the Democratic leadership are for a public option. So that gives me some cause for optimism here.
Democratic Senator Chuck Schumer of New York, who tried hard but was ultimately unsuccessful trying to get the public option into the Senate Finance Committee's health reform bill today.
Fight's not over, Rachel. Fight's not over.
Fight's not over. And you being able to tell us what's going on as it's happening from Capitol Hill is invaluable. Thank you for your time, sir.
Thanks. Bye-bye.